Hey guys, welcome to Butterfly Learning's YouTube channel. Today we are talking about 7 mistakes that parents of children having speech delay should avoid. Speech delay happens in toddlers when they are not reaching the developmental milestones that are expected for their age. The first 3 years are very important for parents to monitor a child's babbling and vocalizations to determine whether the child is developing normally or has a delay in speech. What parents do after discovering this is the most important factor that will have a significant impact on the child's life. The plight of the parents is very understandable. It is confusing and emotionally daunting for them to discover that their child has a speech delay. They wait and hope for the child to start speaking soon. If your child didn't say his first word between the ages of 1 and 2, consult a pediatrician. A pediatrician will give an accurate diagnosis. If your child has a speech delay, they will recommend a speech therapist who is appropriate for your child's specific needs. 2. Denying that fact the child has speech delay. It is difficult for parents to accept the fact that their child has a speech delay. They slip into denial in order to avoid facing this harsh truth. Parents get scared when their child is not speaking like other children of his age. And speech delay robs him of the opportunities they have, like starting school and making new friends. However, living in denial can be detrimental to your child's development. Please allow yourself to feel the emotions you've been suppressing. It's an important step toward accepting the harsh reality that the child faces difficulty in speaking and will require assessment and therapy. We understand this doesn't go with your expectation of the child having a normal childhood, but early intervention helps the child to learn skills he needs to live a happy life. 3. Following the wrong advice from people in the internet. You share your concerns about your child's speech with your family, friends, and colleagues. They give you an example of someone they know. Oh, my cousin didn't speak until she was 3, but in middle school, she won multiple debate competitions and in college, she took part in classical dramas. She turned out to be fine. This might be true for that person's case, but do you want to take a chance in your child's situation? Another problem that parents face is that they tumble into misinformation that is available on the internet as blogs, posts, forums, and videos. For your child's developmental well-being, you need to consult a developmental pediatrician and a pediatric speech therapist if you are unsure whether your child has a speech delay. The biggest benefit here is after an assessment, the speech or language pathologist may find out that your child is absolutely fine or recommends intervention that will help him progress. An assessment from a professional not only addresses your worries, but gives you appropriate solutions or measures that need to be taken. It will free you from the worry caused by misinformation. 4. Going to the wrong medical professional. Visiting a general doctor of choice for your child's speech-related concerns may not be the right medical professional. We recommend that going to a pediatrician is the first step in the right direction. Another important step you must take is getting an appointment of a qualified pediatric speech therapist or speech-language pathologist, SLP, for an assessment. 5. Trying to give speech therapy on your own. Giving speech therapy to your toddler on your own is not a viable idea. The reason is you'll take strenuous efforts to increase your child's speech and yet it doesn't show any result. If you want to do the therapy at home, make sure you have the supervision of a speech therapist. Get a proper therapy plan from the speech therapist before you begin. A certified speech therapist will advise you on which speech exercises to do at home with your child. Also, they will point out the mistakes and teach you the correct practices when you communicate with the child. 6. Not doing practice at home. A common misconception parents have is that after enrolling the child for 1 to 2 hour sessions, he will start speaking automatically. Speech therapy requires a two-way effort. The therapist can only teach the child skills and involve him in exercises that increase his vocalizations, speech or language. He will only learn the skill if it is practiced at home. Otherwise the child will do well in the clinic and doesn't speak at home. After the session, the therapist might give you activities, practices as homework. You just need to take some time out for your child. It will have some instructions like, say teddy, say ball, h. If the child says it correctly, then give him positive reinforcement. You just need to collect the data in a simplified manner. For example, how many times did he say teddy in 1 week? This allows you to monitor the child's progress. 7. Not updating your knowledge on speech delays. Updating your knowledge of speech delay helps you to differentiate the facts from misinformation. It also gives you more information and plays a crucial role in finding the right services for your child. Learning about it will be beneficial for your child as well. You will stay up to date with advanced protocols and will discover the programs that are appropriate for his age. By doing this, you and the speech therapist will be on the page. With regular practice at home, you will help your child to progress through the stages of speech development more quickly. Thank you for watching, and for more such content, please subscribe to Butterfly Learning's YouTube channel.